How do you treat strokes exactly?
The treatment of stroke depends on the type of stroke. So if it's an ischemic stroke with the large blood vessel is blocked, then we have to remove the clot. It is called mechanical thrombectomy. What we do is we go through the blood vessel in the groin using special tubes.
Small enough to get inside the blood
Small
vein.
enough to get inside without damaging the blood vessel and without causing any reaction, because it's a foreign body. So these are special tubes. And we go all the way to the neck.
Wow, how can you guide that tube from the groin to the neck?
We have a cath lab. Cath lab is a machine which is a special CT scanner kind of machine which gives us a real-time image.
So that tube has a camera in front?
The tube is what we call radio opaque. So it comes like a black tube. So using the machine and using these wires, we guide it to the neck and we keep special stents. We open the stents. So the stent will hold the clot and then we pull the clot out. And that opens up the blood vessel. That is for large blood vessels. Some small blood vessels you cannot reach so far. The tube will be as small as the blood vessel. You cannot pass a microcatheter there. So then we have clot dissolving medicines for that. There are special clot dissolving medicine which have to be given within 3 to 4.5 hours maximum. Beyond that, the clot will get organized. It will become hard. And by that time, there's a risk of having other changes in the brain because of the stroke which has already occurred.
What do you do after it exceeds 4.5 hours?
There's nothing much that you can do but try to give medicines which can reduce the swelling.
So you mean you can't remove those strokes?
Those you can't remove.
Whoa.
In our country, we tend to ignore.
Right. No much education on stroke.
There's no much patient awareness of stroke, and patients delay, don't come on time. Hemorrhagic stroke, bleed. There is a different way of treating it. If it is an aneurysm which has, as I told you, a balloon which has burst, what we do is we put either coils, we put small microtubes inside the aneurysm and we coil it so that it is clotted or blocked from inside. These are made of platinum. They form a clot, and inside the aneurysm, if you form a clot, it gets sealed. So that risk of it bleeding again is not there.
If it's ruptured, then you can't coil it, right?
It is ruptured. The rupture kind of seals on it after some time.
It's like heals itself.
It kind of self-heals for a temporary period of time, and before it ruptures again, the risk of rupture is there for aneurysms. The risk of rupture in the next 1 week is up to 30%. So you have to do the procedure as soon as possible. That is, one is coiling. The other way of treating it is called clipping. What we do is we open the skull, go to where that blood vessel is weak, and then we put something like a clip. So you clip it so that that aneurysm is totally blocked and the blood will not flow into the aneurysm.
So clip is kept there only?
It's permanent. Okay. Coil also is permanent.
So when do you decide when to clip, when to coil?
That's a very good question, even neurosurgeons. That question is intrigued even neurosurgeons. We have a lot of debates in conferences. Which aneurysm should be, when to clip, when to coil.